I am here to talk about how doctors in their everyday life use nuclear radiation on their patients to diagnose cancer and other harmful diseases. Doctors use nuclear material more than people have ever thought they do. They mainly use them to diagnose cancer, and they can do this by using it in their nuclear medical scans. Nuclear scans are mainly used to diagnose cancer. They are painless procedures. It's just like taking an x-ray. These scans make pictures that can show tumors in large sections of cancer. They do it by scanning the body's metabolism instead of forms and large shapes. They use liquid substances called radionuclides. These substances use a small amount of radiation that go around the body, allowing the pictures to be taken. This is done by special cameras that pick up the patterns of disease. The body then absorbs the radiation, but only in the parts affected by certain diseases, exactly like cancer, and these areas then show up on the screen. They show up as a hot spot on the pictures, meaning that it will be a warmer color, or in some cases an extremely cold spot, such as dark blue or purple. This type of testing, although extremely accurate and widely used, cannot pick up the smaller tumors in the body and also does not tell them if the tumor is benign or malignant. Benign means not dangerous, while malignant is extremely dangerous to the person containing it. The patient is injected with a tracer, and this is done by either swallowed, put in the bloodstream through an IV, or inhaled as a gas. This is usually taken as a small amount of liquid that radiates small amounts of radiation, allowing the camera being used by the radiologist to pick up the disease very quickly once the tracer is absorbed. They usually do not use this type of diagnosis alone. They also put with the imaging and screening. It is not a short process. It can take hours or even up to several days due to the tracer needing to be absorbed into the bloodstream or the bones or the organ containing the disease, making it so that it gets to the certain place that the doctors are trying to figure out is infected or not. The radiation waves that are pushed off of the body are known as gamma rays and taken with a gamma camera. The computer processes the testing and turns them into a 3D or 2D figure, giving an all-around look of the disease. The color is later on added by the computer as well to give them the cold spot or warm spot look. It is mainly used for cancer diagnosis, but is also used for bone scans. This is the second most popular use of these type of scans, considering it allows professionals to detect changes in the bones, including bone marrow, much quicker than other diagnoses. Patients are required to change into a hospital gown or their own clothes as long as they don't interfere with the rays. All jewelry must come off before these tests, or they could interfere with the accuracy of the waves coming off of them during these tests. The test itself takes 30 to 60 minutes in order for the camera to get accurate positions and to get all the gamma rays to show up on a radiologist screen. This is only for cancer screenings. Other screenings such as the bone scans and MGA scans, it can take much longer, maybe a couple hours, in order for all the radiation to be absorbed in the correct areas. Doctors use this on a daily basis in order to detect and give them information on what areas are infected and need to be focused on during later treatments immediately.